Hello, hello, and welcome to Business Insights and Clinical Nuggets. I'm Charyse Williams, and we have Dr. Orlandis. Hey there, Dr. Orlandis.
Hey, Charyse. Hello, everybody. Good afternoon.
How are you?
I'm doing amazing. Thank you. And yourself?
I'm doing fantastic, doing
Awesome.
fantastic. So
Awesome.
excited to bring them the good stuff today. We didn't talk about who wants to go first. You want to go first? You want me to go first?
I'll knock it out.
Knock it out. Go
I'll knock
for
it
it.
out. I'll
Go
knock it
for
out. Since I missed the last one, so I guess I can make up for
it. Sounds good.
it. Well, our clinical nugget this week is we know that hypothyroidism is underactive thyroid is prevalent. We know that there's over 25 plus million people that's diagnosed with thyroid disease, and there's another 50 million that's walking around symptomatic. They just don't meet the criteria. So there's a lot of time. We know most symptoms of thyroid disease are weight gain, fatigue, hair loss, dry skin, brittle nails, cold hands, cold feet, constipation, low depression, low libido, all those kind of things. So there are people right now walking around and getting their labs tested, and they're told that they're normal. But what a lot of times we check the TSH and they do a reflex to a free T4. That's so under that testing is so underwhelming. I see why 50 million people plus are still walking around diagnosed because they're missing it. So what I want to give on another nugget is thyroid antibodies. Nobody hardly ever checks thyroid antibodies. I've had patients come in here, been on thyroid medication for 20 plus years, and she's never, ever, ever had a thyroid antibody screen done. So what is a thyroid antibody screen? Now, there's different types, but the two most common ones are one called thyroid peroxidase enzyme. That is the one that goes and actually that's the worker in the factory. The thyroid gland is the factory. The thyroid peroxidase is the worker that goes and makes the thyroid hormone. And then there's another called thyroglobulin antibody. What thyroglobulin is, that's the actual product. That's the actual thyroid hormone that's going to be taken and secreted out into the bloodstream. The thyroid gland is the only gland that actually stores its own hormones, like the ovaries, estrogen, progesterone, testosterone, makes it, leaves it out. The male's testosterone, the testicles make testosterone, manufacture it, sends it out, doesn't keep any. The thyroid gland actually keeps a reservoir of hormones back, I guess, in case of emergency, in case you need it. That's good and that's bad, because what happens if it's an autoimmune attack on thyroid gland, you're going to spill all that hormone into the bloodstream. So a key to I do it on everybody. I check it on everybody. But if you're taking care of someone who's had thyroid disease or years, or you just can't figure out what's going on, what you can do is get the historical trend of the TSH levels. If it's up and down, going from 1 to 3 to 4, back down to 0 to 2 to 8 to whatever, if it's up and down like a roller coaster, that's a good sign that there could be an autoimmune component to your underactive thyroid. So the woman or the man on thyroid hormone for 20 plus years and on the Synthroid is not feeling any better, now you know why, because there's an underlying autoimmune condition. 80% of thyroid disorders are autoimmune. 80%, 80%. That is like crazy. So not only should you screen everybody for the right labs, and we talked about it on another one, insight in our Prosperous Practitioner program, we go over every last one of the markers, but you need to at least add the thyroid antibody screen, which is TPO antibody, is thyroid peroxidase, and TG antibody, which is thyroglobulin. The numbers you look now, anything outside of normal, they say some labs can have 0 to 34, some have 0 to 9, but as long as you can't call it Hashimoto's, is the name that we're looking for, by a Japanese doctor who discovered it. If it's outside the lab range, you can say it's Hashimoto's. I don't care if it shows up as 1. If I see an antibody, that means it's been triggered. There's something triggered your body to make an antibody against that marker. So I'm going to be thinking there's some process going on. It may not be full-fledged autoimmune Hashimoto's just yet, but I got a sneaky suspicion we may be heading that way. So if you're taking care of thyroid hormone people, thyroid globulin should be less than equal to 1. That's its range. So, but based on what I'm saying, anything outside of the standard lab range, go ahead and call it Hashimoto's autoimmune thyroiditis. Now there is Graves' disease. That's a whole nother topic. So we'll leave that one alone, the antibodies that go along with that one. But since hypothyroidism, Hashimoto's autoimmune is the most common cause of thyroid dysfunction, check those 2 antibodies on all your thyroid patients or people you suspect those unstable TSHs that's all over the place. Check the thyroid antibodies. You may be surprised. You may diagnose an autoimmune condition that they didn't even know they had. And trust me, I got a lady 73 years young and did not know she had she's been on thyroid medication since 1950.
Wow.
And did not know she had Hashimoto's. When she said, "What is that?" I was like, "Oh, let me tell you." So check the thyroid antibodies. You'll be surprised at what you see and why your clients or your patients or health partners are not getting better. It could be an autoimmune thyroid condition. And that's my clinical nugget for the day. Check those thyroid antibodies on everybody if you can.
That is so good. And, not too long ago, Dr. Orlandis, you did a special training on how to heal the thyroid without treating the thyroid. Yeah. You guys, if you are in this space or if you have a desire to work specifically with people that have thyroid issues, or you wanted to just really understand it a lot better, just drop the word thyroid below and we will make sure that you get access to that, because it was definitely an eye-opener, and always an eye-opener. And so thank you for that. And the other thing I was going to mention to you is, or to everyone, is if you... Is that you? What is that? Oh, okay. Clearly, I'm easily distracted. Anyway, if you missed the masterclass, by the way, we had an incredible masterclass. Was that yesterday? It was yesterday. So it was a while ago. It was last night. The secret language to blood work that most doctors miss. You guys, if you missed it, I'm gonna say you missed it, but lucky for you, we actually have a replay that's available for another 24 hours. So if you are seeing this and it is within 24 hours and you want to see that masterclass, just drop the word secret below. Drop the word secret, and I'll make sure that you get access to that. Again, it's only going to be available for the next 24 hours. So that being said, Dr. Orlandis, that was a phenomenal clinical nugget. I want to share. You're very welcome. I want to share with you a little bit. I want to share some business insights. And the reason why this is coming up is because, again, conversations that I've had most recently with two sets of people, or let me just say 2 demographics, people that are just starting, or clinicians who are just starting their holistic health business, and then some that have been in business for a while, they just haven't had a consistent flow of clients. And so they're, as I kind of say, they're on the struggle bus a little bit. And it's around, like, what do you say? How do you get people to say yes? How do you get people to enroll into your programs? And so here's the thing. There are lots of components. It's not just a one solution. It's a multifaceted solution. But I will tell you, one thing that I find that where you're probably going wrong is that when you are having the conversation, and let me just put it out there, there are people already in your experience now. For those of you who are looking like, where would I get clients? Trust me, they're already there. You're just not being clear. You're not having the level of clarity and articulating the level of clarity that they need to hear, so that they know what you do and what problems you solve. Because here's the thing. If I'm someone who's struggling with thyroid issues, and let's say you can help me with that thyroid issue, but you never say that. You say, I can help everybody get better, or I can help you elevate your health or optimize your health. I need to know you can help me with my thyroid specifically, right? And so, but if you're not saying that, all of you have clients all around you, potential clients all around you, and you're missing them because you're not speaking to them in their language. Okay, this is something that we deep dive into in the Process Practitioner Program, and we help you really pull out of you what it is that you are wanting to do, what problems you're wanting to solve, and then equip you with not just the words and the confidence, but also the clinical and the business piece, so that way you can bring yourself to market and actually enroll clients. So what to say? That's like the burning question in the last couple of probably over the last week from several clients or potential clients I've spoken with. Here's the thing. Let me tell you what you're doing. And you can put that's me if you want to in the comment section, or you don't have to say it at all. It's okay. But what I find is you're so excited about what it is that you do. You're so excited. You're wanting to convey your expertise and your value, and you want to like tell them, I can help you. And so what you do is you vomit all over them. Like you vomit all about you, all about your expertise, all about your program, all about everything. And you're not asking questions. When you are wanting to have an effective enrollment conversation, what is absolutely paramount is that, number one, they should be doing about 90% of the talking, 80 to 90% of the talking. If you find that you are doing 80 to 90% or more of the talking, you want to fix that right then. And that's one piece that you want to fix. You should be asking, they should be answering, okay? Because all of the answers are inside of them. I'm going to repeat that. All of the answers are inside of them. It is your job to ask the right questions so that they can articulate what's going on with them. And basically, they kind of enroll themselves into your own program, into your program, okay? So what are those questions? And you guys, these questions are very nuanced. I'm going to do a high level. I'm going to give you just 4 questions. They're more nuanced than just asking the question. There's more to it. There's a psychology behind it. There's a level of understanding behind it. There's a level, and there's a way in which you want to, and a mindset you want to be in when you're asking these questions. But let me at least share the questions with you. Again, we deep dive into this and teach this extensively inside of the Prosperous Practitioner program. But you're going to ask 4 questions. And the first, so you're not going to just vomit all over them and tell them all about you and your program and how fabulous you are. Because here's the thing. Of course, you're going to say you're fabulous. Of course, your program is amazing. No one has an ugly baby. No one thinks their baby's ugly, right? You're not going to say, oh, my program, it sucks, but you should enjoy me. You should enroll with me. No, of course, you're going to go on and on and on. So that's not what you want to do. What you want to do is you're going to ask questions. And the first question is, what is that you want? Very simple question. What is it that you want? Let them answer. You'll be surprised. Oftentimes you will be surprised at what they say. The next thing you want to ask them is, why do they want that? Why? Why is that important to them? Again, you clinically, you might think, oh, I know why. I know what she wants. She wants to, fix her thyroid and get off her medication. You don't. That may or may not be what you ask her. Or him. Don't assume. Ask. Why is that important to you? You might think clinically, well, it's important because you're having problems with your weight, because you are constipated, because you're depressed. Ask them. Let them tell you. It's not about what you know at this point. It's not about what you know. It's about them telling you what is urgent for them, what is happening with them, and why is it important for them. So what is it that you want? Why is it that you want it, or why is that important to you? What happens if you don't get that? What happens if we don't fix your thyroid problem? What is that going to affect? How does that affect your life, your relationships, your productivity, all the things? And then the fourth question is, what becomes available to you when you do fix this problem? When we do heal your thyroid, when we successfully get you off medication, whatever the case may be, however it is that you're working with them, and whatever the end goal is for them, ask them what now becomes available to you now that we have fixed this problem. You think you know, oh, you're going to have so much energy, you're not going to be depressed anymore, you're going to be able to lose weight. That may not even be, that might be in the background. That might be, yeah, they may want that. But let me tell you something. Here's the thing. It's never just the seen issue. Like the seen and the known issue is, oh, my thyroid. Oh, I can't lose weight. Oh, I'm depressed. Oh, I'm fatigued. That's the seen issue. It's never the seen issue that makes them say yes. Remember I said there's nuances to this. It's never the seen. It's actually the unseen. But you can't get to the unseen. You can't help them uncover the unseen unless you're asking these levels of questions. Okay? All right. So we'll leave it there because that's a whole hour training. Again, we if you find yourself in this situation where you're like, yep, that's me. I'm telling everyone how great the program is. No one's enrolling. It's because you're doing all the talking and you're trying to sell yourself and sell your program and sell your expertise. And that's not the way you want to go. You want to ask them questions so that way they are basically telling you why they should be in your program. All right. So if that resonates with you, if you know that you need to learn that skill, because that skill literally will make you thousands upon hundreds of thousands upon hundreds of thousands upon hundreds of thousands of dollars. Just learning that. Wouldn't you agree, Dr. Orlandis?
Absolutely.
we read from the same book on the on many things, but we literally use the same verbiage to enroll clients, and this is how we've created multi-6-figure and 7-figure businesses. This is the big piece. You miss this piece, you miss out. You're missing it. You're missing it. You can do everything right. You get this part, because here's the thing: you're not going to enroll clients, or you're not going to enroll clients at the level that you want to, which means you're not going to be able to make the impact that you're wanting to make, and you're not going to be able to make the income that you're wanting to make as well. And it becomes easy. That's the other thing. It becomes really easy. So if you've been struggling, for like, oh my God, this is so hard, you got to make these tweaks. You need to make these tweaks. You get to make these tweaks, okay? Because it's not hard. Actually, it becomes very easy. So that being said, you guys, that was your business insight for today. And we will see you guys next Tuesday. Last thing, I want to just put a little bug in your ear. If you are finding value in these business insights and clinical nuggets, if you're finding value in them, invite a colleague into the group. Nurse practitioner, MD, whatever, as long as they're a healthcare provider, invite them into the group, you guys, because we can't do it all, right? We can only take so many clients, take on so many clients. But if we can help get you clinically confident with how to understand labs and how to treat the root cause, or help to, or I don't really want to say treat the root cause, but if we can help you identify the root cause and support your clients in their health, on their health journey, that's what we want to do. That's and by preventing all the pitfalls that we made. We figured it out, you guys. We made a lot of mistakes. And so if we can help you in any way, we would definitely want to do that. So invite a colleague into the group so that way they can start learning as well. And that is all, you guys. We'll see you next week for Business Insights and Clinical Nuggets. Bye for now.
Have a great week, everybody.
Bye.